So again, my research entitled Protective Effects of Tualang Honey on Testes of Rats Subjected to Chronic Combined Stress. So these are the outlines of my presentation. Right. In this study, I have two important variables, which are stress and also Tualang honey. So for introduction, stress can be defined as a non-specific response to any stress, any demands that threaten homeostasis, which requires and necessitates adjustment and also response to maintain equilibrium. So there are stress sequence which was proposed by Darba in 2000. All right, the stress sequence begins with a stressor, an internal or external challenge. Sorry. External challenge that threaten homeostasis. Then the individual engages with stress in stress perception, evaluating the threats and their ability to cope. All right, and then the stress perception is perceived, if it is perceived as harmful, the stress response is triggered, involving physiological, behavioral, and also emotional changes. So this process may result in either successful adaptation or maladaptation, potentially leading to chronic stress and health effects. So according to another study, which was done in 2005, all right, stress can be classified based on its duration and intensity. In terms of duration, stress may be acute, which is lasted for a short period of time, and it can be chronic, which is persists over months or year. And based on intensity, the stress ranges from mild to moderate, and it can also be severe. So mild to moderate stress may be adaptive and enhance performance, while severe stress may disrupt the coping mechanism and may cause cellular changes. All right. So stress can influence any system in the human body, including the reproductive system, which is the main focus of this study. So the chronic stress is recognized to be a risk factor for the reproductive function and a contributing factor to a rising rate of infertility globally. So in human population, infertility has been recognized as a public health problem, and it's been going on for more than 2 decades, I think. And then according to Agarwal in 2015, infertility is a significant global health problem affecting approximately 15% of couples globally. So male factors contribute to about 20 to 30% of infertility cases alone, and when combined up to 50% when combined with the female factors. And this condition is multifactorial, but one of them includes or related with the oxidative stress mechanism that impairs sperm function and the male reproductive parameters. And global infertility prevalence was difficult back then, and due to limited and inconsistent data from different regions. And more recently, WHO has come out with robust estimates showing that 17.5% of individuals globally are affected by infertility, and it is about 1 in 6 or 1 in 7 individuals. All right. And then to understand the effects of stress, we have to first we have to understand the normal stress pathway. So in males, stress alter hormonal regulation at multiple levels of both the HPA and HPG axis, which is the hypothalamic pituitary adrenal axis and hypothalamic pituitary gonadal axis. So these two axes particularly affecting the glucocorticoids, mostly the cortisol and also corticosterone, and the gonadal steroid, the testosterone, steroid or hormone. And then the stressor involved may be may include the external factors such as physical and psychological stimuli, as well as the internal physiological disturbances such as the underlying pre-existing diseases. So these two axes also reported to have reciprocal relationship whereby the glucocorticoid secretion caused by stress or chronic stress, it may suppress the neuroendocrinal activity of the gonads. All right, and while the production of testosterone can modulate the magnitude and the sensitivity of stress response. So continuous suppression of the HPG exists by the reciprocal effects of HPA stimulation may reduce the testosterone production, leading to significant changes in testicular morphology and function. In stress response, in the presence of chronic stress, the reciprocity effects of the HPA axis on the HPG axis results in reduced production of the GnRH, LH, and also FSH. So the reduction of LH leads to reduced production of testosterone by the Leydig cell, while the reduction of FSH leads to reduce in function of Sertoli cell to regulate spermatogenesis. So therefore, the arrestment of germ cell lineage, all right, occur due to direct and indirect effects of FSH and LH respectively. So what happened in the arrestment of germ cell lineage? The development of spermatogonia is stopped at this level, the spermatogonia level. So there is no production of spermatocyte and also spermatid. Therefore, there is no production of sperm, mature sperm. So that said, it can reduce the spermatic counts, the sperm count, the sperm storage and production, and its motility. And this may account the spermatogenic cell lineage in the seminiferous tubule. So it affects the height and diameter of the seminiferous tubule. And then all of this will can also related or commonly closely related with the reduced testicular weight. And ultimately that will cause infertility in males. And then another thing is about Tualang honey, which is one of the most popular nature-based product in Malaysia, and it is known for its medicinal properties and therapeutic range. It is produced by the Apis dorsata species of Asian rock bees, which is larger than the common bee. All right, there are many chemical components of Tualang honey. The main focus are the phenolic acid and also the flavonoids. These two are highly related with its antioxidant and inflammatory properties. So there are many properties of this honey. So the main focus of these are the antioxidant and anti-inflammatory. So Tualang honey, it is said that it possesses great antioxidant content and also radical scavenging action or activity in its cellular component. The Tualang honey has been reported to be the second highest antioxidant content among the other Malaysian honeys, and the supplementation of Tualang honey has been proved to lower the oxidative stress marker due to its phenolic acid and also flavonoids. So it is capable to minimize the chronic effect by enhancing the Leydig cell viability, reduction of lipid peroxidase. So it can minimize the infertility outcomes in males. And then another study reported that Tualang honey also improves the pregnancy outcome by reducing the corticosterone level and the other adrenal parameters. So this is also related with this study. So my study, the objective of my study was to investigate the protective effects of Tualang honey on stress-induced male rat model. So these are the 5 components and parameter which was tested. Right? These are the specific objective, which was to compare these parameters between stress-induced tualang honey supplementation with related controls. The methodology for this is a animal experimental study which was done at the Animal House of USM somewhere before the year 2000. So I use 24 spread dolly rats authorized by the ethics committee, animal ethics committee, and the tualang honey was obtained from farmer. And then I used two stress protocols, the restraint stress and also forced swimming test. The restraint stress was conducted 5 hours daily, and the forced swimming was done 15 minutes daily, which was alternatively done procedure for 21 days. And then the statistical analysis was done was the one-way ANOVA and followed by the two keys post hoc test. So these are the research flow chart. So after I secured the rat, there was a randomization in 4 groups: the control group, stress plus honey group, and the honey only group. So the stress group was imposed with stress procedure, while the honey was supplemented. The honey group was supplemented by 1 gram per kilo of tualang honey twice daily, so which was pre and post procedure. And then after on 22nd, day 22nd, sacrifice was done and the blood and testis was taken for histomorphometric study and also biochemical study. I only use H&E staining because due to cost limitation, and ELISA, which was only done for testosterone and corticosteroid concentration. And then the data analysis, result interpretation was done, and report was submitted. And as for the result, for the serum corticosterone, the statistical analysis revealed that the mean serum corticosterone level in rats in the stress group was significantly higher than those in control group. These results imply that the rats were subjected to adequate quantity of stress throughout the duration of the trial. So the mean, and another one, the mean corticosterone of the honey plus stress group and the honey group was significantly lower than the stress group. And then for the serum testosterone concentration, the result revealed that the blood testosterone level in the stress group was significantly lower than the control group. And the mean testosterone concentration in the honey plus stress group was higher than the compared to the stress group. And for the spermatid and seminiferous epithelial height, the rats in stress group of both parameters showed lower mean compared to the control group. And then the other results also showed that the spermatid count and seminiferous epithelial height in the honey and honey plus stress group was higher than the stress group. So next is the seminiferous diameter, which was the analysis showed that the mean diameters of the seminiferous tubule of stress group were significantly lower than those in the control group. And then the honey plus stress group was significantly higher than those in rats in the stress group. And the last one, the parameter which was tested was the testicular weight, which revealed that the mean weight of rat testicle in the stress group was significantly lower than the control group, and the mean testicular weight in the rat in the honey plus stress group were higher than the S group, the stress group. However, the difference was not significant for the honey plus stress group. So this means that the stress imposed was significant, which is the effects of stress was successfully imposed, and honey, the tualang honey, it has potential to reduce the effect of stress. So as for the discussion for serum corticosterone and the testosterone concentration in this study, the stress threat showed significantly higher corticosterone and lower testosterone compared to controls. So confirming that stress induced, again, the stress was induced was adequate, and it confirmed it suppressed the reproductive parameters. And then the combined stress protocol produced a stronger hormonal response than single stressor models. So explaining the marked testosterone reduction, and Tualang honey supplementation showed a trend towards increased testosterone, although the statistically was not significant, suggesting partial protection against stress effects. And the reciprocal relationship between HPA and HPG exists, explain how chronic stress disrupt hormonal balance and how does it impair fertility. And then for the spermatid, seminiferous epithelial height, and the diameter, the increased corticosterone and reduced testosterone impairs. This is the theory. And in this study, the stress caused significant reduction in spermatid count, decrease and the seminiferous epithelial height and diameter. So this indicates, or it can be postulated, that the changes was the arrest. It proved that there is arrestment of spermatogenic cell cycle, increased apoptosis of spermatid, and dysfunction of Sertoli and Leydig cell due to glucocorticoid effect. So the structural degeneration of seminiferous tubule effects impair the germ cell proliferation and differentiation. And for the supplementation of Tualang honey, it is proved that it can significantly improve the spermatid count, the epithelial thickness, and tubular diameter. And it is likely due to strong antioxidant properties, which reduce the oxidative damage and help restore the testicular cellular component or function. And then lastly, the testicular weight was related to the quantity of germ cell and the integrity of seminiferous tubule. And the reduction in the spermatid number, the epithelial height, and also the tubular diameter leads to loss of cellular mass, resulting in decreased testicular weight. So the chronic stress, therefore, causes testicular atrophy-like changes through suppression of spermatogenesis. So this is the postulation which was proven or supported by the previous literature. And then the Tualang honey, the improvement of these histological parameters with the Tualang honey suggests its role in preserving testicular structure and preventing the weight reduction under stress condition. So as for conclusion, Tualang honey supplementation has the potential to reduce detrimental effects of chronic stress on testes by improving the spermatid count, seminiferous epithelial height, and diameter. And this indicates enhanced spermatogenesis and partial restoration of reproductive function. These findings suggest that Tualang honey has a protective role against stress-induced testicular damage due to antioxidant properties, and further study are required to clarify its influence on testosterone level and the underlying mechanism involved. So these are one of the achievements presented in the NHA's seminar back in 2021, and Best Presented Award for IPES conference. And then I have published this paper in MJMHS 2024. By that, I thank you.
Okay, thank you very much, Dr. Syabil, for the insightful and informative presentations on the protective effects of Tualang honey against chronic stress-induced reproductive changes. Now, I'm open the floors for any questions that we'll ask our presenter. Any questions from the floors?
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Prof. Sahana, Dr. Zahir.
Kami.
Dengar tak?
Dengar.
Okay, first of all, congratulations, Dr. Syabil. I think a very, very good slide, excellent slide. I enjoy the slide, very clean and very clear presentation from the start. And also congratulations for your completed research. Well done research. Perhaps I missed your study objective. Do you have your slide on the
Study
specific objective?
Give it please open this. Okay.
Okay.
Okay,
So it's more like very diagrammatic objective. Maybe I'm not that clear for a very specific objective that you're looking for. My point is, of course, it's study well done. Okay, just my concern. I mean, not a concern actually. My few point to us is regarding when your study, either you looking at the direct effect of the Tualang honey, okay, direct the effect on Tualang, or indirect effect of Tualang honey on the testicular parameter.
testicular parameters. Direct effects.
Or are you looking at the both? Because from your conclusion, you said that Tualang honey has effect on the, reduce this stress, outcomes. And is it indirectly towards the testis parameter or the spermatic count, everything, or Tualang honey direct effect to the testis?
All right. Based on for this study, what I tried to explore was the potential effects of Tualang honey to reduce the stress effects on testicular parameters. But based on the literature, there is the stress can affect many levels of the HPA or the HPG exist. But what I've tried to prove that the sum of the parameters of Tualang of the testis, okay, the male reproductive system, by doing the objective. This is for objective 3, 4, and 5 is the component of the seminiferous tubule, and then these two is the component, the hormonal component, which to prove that by the reciprocal effects of corticosterone by the HPA axis can influence the reduction in testosterone concentration, and how does Tualang honey can improve the effects of the corticosterone by the reciprocal effects of those two axes.
Okay. I think if we have a clear objective, actually to relate for this presentation, perhaps the direct and indirect effect of Tualang honey can be more elaborated or highlighted lah. Towards the outcomes of your research rather than the stress factor. The stress factor can be some mediated effect to the the fertility parameters. Okay. But otherwise, it's a very good presentation. Thank you, Dr. Syabil.
Thank you very much, Prof.
Okay. Is it another questions from the floor?
Assalamualaikum.
Waalaikumsalam. Okay, Prof. Asma.
Okay, I'm Nur Asma from Biomedical Science, PPSK. I have one question because we are looking into the how stress regulates the male sexuality, because I saw that in your result just now that supplementation with honey actually increased the level of corticosterone. So how does the honey actually affects this corticosteroid level? I saw from your results that, yes, this one.
Corticosterone concentration in
Yes, you can
stress.
see that the honey bar actually is higher than the control group,
Oh, okay.
significantly higher than the control group. So how does honey actually increase the level of corticosterone in this context?
For this, according to literature, the uh, the level of cortisol release in different individual, I mean rats, can be different. The range is between it has a very large or very wide range. So which I did the calculation is actually there is some apa ni differences between individual rat. So I couldn't prove anything from this from the increment of stress and the control group for the corticosteroid concentration.
Okay, but actually, if it coming from the animal itself, it shouldn't give the significant level of, increase of these corticosterone levels. It seems that the honey supplementation actually, helps in the increase of the corticosterone level in the animals. So it's actually very interesting to explore further how this honey supplementation actually affected these corticosterone levels. Because yeah, you have to take into attention, because we are looking into the effect of stress on the corticosterone levels, right? However, the honey itself already increase the level significantly. So yeah, it's something you have to explain better.
Perhaps I will look into it.
All right. So thank you.